Do I require eyelid surgery? Which surgery can give a look of bigger eyes? The eyelid is covered by skin. What can be done to correct this?
Thank you for your question. You submitted a simple question where you feel that your eyelids are covered by skin and which surgery can make you look like you have a bigger eye. And you sent two views of your eyelids. So essentially what I think you're asking is that the folding of skin over your eyelid is creating the appearance of making your eyes look smaller. Now, this is a look that a lot of people are used to having where they have fullness over their eyes. But as time goes on, sometimes that fullness becomes too crowded over the eyelid, typically in the platform, what we refer to as the eyelid platform, and the place where a lot of women would apply eyeshadow. So, in order to improve that appearance, you have essentially a couple of choices. A more conservative choice is to do a procedure, a non-invasive procedure, that temporarily lifts your eyebrows. Okay, so what that means is when your eyebrows are slightly elevated, well, then that reduces the amount of skin and soft tissue over your eyes. And we do that in our practice with something called Dysport or Botox. It's called a Botox brow lift. And what we do is we relax the muscles. We relax the frown muscles and the muscles that depress or bring down the eyebrows, and it causes a passive lifting. Now, it's about a 1 to 2 millimeter lift, so you don't have to worry about looking perpetually surprised. The great thing about doing a temporary lifting with a non-invasive procedure is that it is temporary. And so if you don't like this look, which I think most of the time is very rare in my practice, then you will certainly have no issue in a few months when the Botox or Dysport wears off. Now, I have seen that a lot of people are fine with just that non-invasive approach. But for people who want a little bit more eyelid showing and who aren't good candidates for an eyebrow lift, then the most typical procedure I employ is a cosmetic upper eyelid blepharoplasty. Now, cosmetic upper eyelid blepharoplasty involves the artistic reduction and contouring of the excess skin from the upper eyelid, as well as some fat and soft tissue that prolapses over. Now, there is a true art to doing this. It's not about taking out all the skin you can possibly, as well as creating just the right shape. Unfortunately, a lot of our colleagues will be very aggressive and take out a lot of skin and a lot of fat. And paradoxically, it can make someone look older and hollow. So, when I talk to my patients about this procedure, I get very detailed about what would be a satisfactory result. In fact, one of the things I do is I'll literally place like a Q-tip or an instrument to create a crease and show them in the mirror what they would potentially anticipate so that they get a better understanding of what to expect after surgery. That being said, as long as you are comfortable, and I think that a very important thing to do is look at a surgeon's before and after pictures, and you'll get a sense of the style. Doing this for over 20 years, I have hundreds and hundreds of before and after pictures, and we're very happy to help our patients understand my personal style. And of course, there are several of my own staff members who have had the procedure, and so they show them their incision line and how they look. So my advice to you is, once you have explored your basically the non-invasive and the more invasive option, interview some doctors, some experienced cosmetic surgeons who do a lot of eyelid surgery, and get a sense of what their style is. And once you feel like you're in sync and you found the right doctor, move forward and have the cosmetic upper eyelid blepharoplasty. So I hope that was helpful, and thank you for your question.